All right, Dara, do you want to kick it off?
Sure. Good morning, everybody. This is Dara Johnson with Access, and I'm joined by my colleague, Danielle Ashlock. You'll hear from both of us today. Thank you for joining us for the Adult Day Health setting discussion, or session rather, for part 4, which we're calling, of the first sessions in part 4, we're calling it the Hcbs rules implementation in a COVID-19 world. So thank you for joining us today. I think we have a small group of folks, but we're going to make the best of it. We really appreciate you being with us today. Next slide. Great. Oh, just a little bit of housekeeping. We certainly have a smaller group, so I think this will be much easier to manage. But just for the sake of not disrupting the presentation, we do have a short presentation today. Most of it's going to be dialogue between all of us, but we do want to present some information to you. So we're going to go ahead and mute everybody during the presentation. After the presentation, when we get into the discussion portion of today's session, we definitely want to give you an opportunity to share verbally out loud with the group here. If you have a comment, a question, something to discuss, so you can use the raise your hand feature, and then we'll go ahead and unmute you, as well as you're also welcome to use the Q&A option to submit a question or a comment. We will be monitoring that throughout today's session. With that feature, if somebody else makes a comment or asks a question that you also are interested in as well, you can press the like button, so it's similar to Facebook. And that sort of helps us prioritize discussion. If there's something that's particularly important for a number of you, then we want to prioritize that with the time that we have allotted today. And then certainly, as we work through today's session and discussion, please, if you have an idea that you want to share, we're going to, include it in that Q&A chat so that we can capture that for our note taking. What we're hoping to do with all of these sessions is put together some information that we can share amongst providers for different ideas and to support some creative brainstorming and compliance ideas with the Hcbs rules. Next slide. So what we're trying to accomplish today in the session, it's certainly been quite a while since we've done any kind of provider training around the Hcbs rules. We started to do a bunch of that right when COVID hit last year. So we're going to do a little refresher. We'll talk at the end, but there's also a refresher webinar that Danielle and I recorded, which is on the website. If any of you want a more in-depth understanding of the Hcbs rules, we have a number of different recordings already up on our website. But today, to help us with discussion, we're going to just go over the intent of the Hcbs rules. Why are we doing this? What does it mean? What are the overarching themes and goals that we should be striving to? And then Danielle's going to talk about what do the Hcbs rules look like in practice for a day program kind of setting like Adult Day Health. What does it look like? And essentially that becomes, what are the assessment questions you'll be addressing when one of the MCOs comes out to do a quality monitoring visit. So as part of the overview, Danielle's also going to go through, what does that quality monitoring process look like? It's going to be a little bit different. There's going to be some new features and new assessments as part of that to ensure our compliance with the Hcbs rules. So we'll go over that so you know what to expect. And then the purpose for today's session, all of those things are really just to help kind of prime you for discussion. We really want to talk with those of you who administer and run Adult Day Health programs and talk about, I think our working assumption for today Unlike other settings, it's going to be, I think most of you were not able to continue to operate during the public health emergency. Maybe you're starting to reopen or think about reopening. Maybe some of you did stay open, but maybe greatly reduce the number of members that you're serving or employ different practices. So I think before we even get into the discussion today, we'll want to just get an understanding of kind of where everybody's at so we can have better discussion that meets your needs for where you're at today. But we want to know, like, what are some specific things that you think you might need to do or in order to comply with the Hcbs rules, or what are things that you're already doing that you think are in compliance, really just to share. And then also, certainly, we want to hear about what challenges you may have so that we can brainstorm them together. We really feel this like peer-to-peer discussion is the best way to support you all in moving forward. And this is really the first session in a series of sessions that we'll be having specific to each setting type. So you'll be able to continue to have these discussions with your peers. Next slide, please. The intent of the Hcbs rules. I apologize. Apologize for the barking, but we'll go ahead. So the purpose of, actually, Danielle, could you take this slide?
Sure. So the purpose of the Hcbs rules is really to enhance the quality of home and community-based services. We want to provide protections to our participants and assure that they have the full access to the benefits of community living, just like anyone else does. And a lot of this we already do, and I'm sure a lot of it you already do. So, making sure people are receiving services in the most integrated setting. And the important part, and really the crux of the Hcbs rules, is to make sure that people receiving services are receiving access to the community to the same degree of people who don't receive services, much like you and I. It's important that people, live as normative of a life as completely possible, and staying, granted we're in a pandemic, but staying, just in a day program indoors all day. While I'm sure that's not what happened, it's not normative if it does happen. So we want to make sure people, when it's safe to do so, can get out into their communities, have access to their communities. The community has access to them. We'll talk a little bit more about what that might look like. And we understand that Hcbs really is a culture shift. These rules are afforded to members off the bat. They don't have to be earned. We just kind of blanket it as everyone gets these rights. And if there is a health and safety risk to the individual, then we can discuss that in the person-centered planning process. And that's where you could work through some maybe restrictions and a plan to get back to unrestricted access when it's safe to do so. So again, that's part of the whole person-centered planning process. For the EPD plans, that should be starting in June, I believe. I believe your case managers are undergoing training right now to implement the process, so it'll be something newer to you. But basically, everyone gets these rights. Everyone gets access to their community. And if there's an individual health and safety risk, we use that person-centered planning process to document that and kind of outline our plan for moving forward. So now I'm going to go through the Hcbs rules from a really high level, just kind of talking about what it looks like specific to adult day health. We have, like Dara said, there's additional recorded trainings on our website where we go into a lot more detail if you want to take a look at those. So employment services and support. These don't necessarily have to be provided by the adult day health program, but we want to make sure you're supporting individuals to find those resources if they need them. Especially right now, this is probably a good thing with all the downtime we're having, but if someone wants to get out and volunteer or work, are you able to support them to learn new skills or instruction for that skill development they might need for employment or volunteering? And we also want to make sure you're supporting individuals to have career exploration opportunities. Right now, especially, this could just look a lot like, you know, YouTube or documentary programs. Really just, no one knows, you know, everything that they could possibly do for work. So it's important just to get exposed to different opportunities or different things that could be actual jobs. I mean, I didn't grow up as a little girl thinking I was going to be a program manager, but you know, just through my experience, that's where it led me. So we just want to make sure people have those career exploration opportunities, much like anyone else. Engagement in community life, probably looking a lot different right now, and we'll talk about it a little bit later, but you can use your COVID-19 transition plan to kind of explain what you're doing differently, if you're not doing anything at all right now because you're closed, and then what you're going to do when you can reopen after the pandemic. But we'll just kind of go through these again from a high level. We want to make sure, people are able to interact with the public. In normal times, this could look like people coming to the program to participate in an activity or provide a training. This can also look like the program going out into the community. We want to make sure individuals are learning activities comparable to their peers, which are the people of a similar age, including people without disabilities. So, you know, for senior citizens, is the activity of the day coloring, or, you know, maybe playing bingo, which is a little bit more normative for the age group. Are we going out to see movies, concerts? Again, not in the pandemic, but just things like that. What are the activities we're doing? Is it something normative to the age group? And then, of course, do individuals have staff support to assist them in participating in activities in the community if they need that support? Control of personal resources. Do people have someone to assist them in managing their personal funds if they need it? Do they get to decide how to spend their money? This could be something as simple as, you know, buying a snack. Do they get to choose which snack they want? Can they access the community to purchase goods and services? So again, if, you know, I really need a Coke that day and there's nothing available at the setting that I can purchase, can I go out to Circle K, buy my Coke and come back? You know, is that within the realm of possibility, provided I don't have those health and safety restrictions? If the person is working, are they being paid for the work directly, or is it to the payment going to the representative? And then are individuals either employed or preparing for employment, provided with information about how their benefits might be affected by that income? And I know at Access, we provide a course called DB 101 that helps kind of provide that information in a little training session, which of course would be a resource to you guys to share with someone if they wanted to work or they're already working and we're curious about the impact. So, you know, not necessarily something you'd have to train on specifically, but you could point people to resources that would help them. Receiving services in the community to the same degree of access as other people. So again, can individuals engage in activities that are specific to their skills, abilities, desires, needs, and preferences, including engaging with activities with people of their own choosing and in areas of their own choosing? Again, probably looking really different right now, but we just want to make sure there's maybe a selection of activities to participate from. Maybe you're getting input from your members on what activities they like to see. You know, can I choose to work with people that are my friends, or do I have to work with people I may not necessarily get along with? If it's a nice day outside, can we do something outside, or do we have to be inside? Just kind of things like that. Are individuals given the choice and opportunity to freely come and go from the setting? So that's just like that, you know, if I want to buy a Coke, can I go do that and come back real quick? And then do individuals have access to transportation to and from the setting for purposes of engaging in community life? Transportation doesn't always have to be provided directly by the program. We know that's not always a possibility, but can you work with the member, find out what resources they have, friends, family, church members, someone who can help them get around into the community in the way that they would like. Setting selection, looking different again, but do you allow individuals to visit the setting prior to choosing to receive services there? So can they take a tour? Can they participate in an activity? Just do something with the group of people there to make sure that it's a good fit for them. I know some programs are doing like a virtual tour. You know, people are getting really creative right now since we're in the middle of the pandemic. Let's see, person-centered plan. Again, something you'll start getting a little bit more used to, but it's going to be something new right now. But we do want to make sure that you're supporting individuals so they can participate in their person-centered service plan meetings. And we also want you to participate in those meetings. These meetings are basically where all the important providers, family members, and friends in a person's life get together and figure out what their goals are, you know, what are things they want to accomplish, and who can help them get there. So it's not always on the program, but this is where you can find those other resources pretty easily. Okay, mom's here, she can help with this. The friends here, they can help with that. And it's the program, this is what I can do to help further that person's goal. We also want you to be able to provide updates on an individual's progress at those person-centered planning meetings. And we want to make sure that your program plan aligns with that person-centered plan. So that could be something that you do simultaneously. Privacy, dignity, and respect. I'm sure a lot of this already happens, but we'll go through it. Individuals receive personal care assistance in private. People receive information about their rights in plain language, and they know who to contact if they have concerns or complaints. We also want to make sure our members are protected against restrictive measures. This includes isolation, chemical, pharmacological, and physical restraint. Of course, we never want to see that. Autonomy and accessibility. So we want to make sure, as much as it's possible, that people get to make decisions about what they want to do every day. We understand you have significant staffing constraints and are only able to do so much. So maybe if there's a group outing to, you know, Walmart, is there an option for someone who doesn't want to go to stay back at the program and you know, work on an activity there? We understand each person may not be able to do what they want to do individually, but if there's something they're really passionate about, say they want to take an art class, is there some way eventually we can work that into the schedule? So really just, you know, working together, figuring out what can work, understanding it may not work tomorrow. And is the setting accessible for people to freely and safely move around? This is a little bit different than ADA requirements. This is more that we don't want to see, you know, people locked into any one room, or, you know, having the kitchen, well, I don't know if the kitchen applies, but having like a kitchen-like or a snack or break room area off limits, because people should be able to figure out, you know, when they want to, if I want to take a snack at 10, even though nobody's in there, is that okay, provided there's no health and safety restriction. Individual choice. So can individuals have the option to make requests for an alternate staff member to assist them? Again, doesn't have to happen tomorrow. We understand your staffing constraints, but if I really enjoy working with Dara, can we figure out, you know, some schedule where I can at least touch base with her and work with her a couple times a week? And are requests for alternate staff members honored when the setting can accommodate into those staffing constraints? You know, just making sure it doesn't have to happen tomorrow, but as much as we're able, can we move things around to kind of get that accommodated? And we want to make sure people feel that they can freely make those requests to the way that their services and supports are delivered. So the quality monitoring tools and process, there's really a tool suite. The provider self-assessment is one part of it. You'll receive that when your health plan is ready to start the assessment process with you. I think they give it to you 30 days ahead of time. So you have time to complete it. You'll answer questions and provide documentation that support your responses. And then when the health plan gets that back, there's additional tools that will help paint a more detailed picture of the great things that you're doing, honestly. So that includes member interviews. Because of the pandemic, these might look a little different. We're thinking right now of having like a small group of members from the program just participate in an interview together, just to get an idea of their feel for everything going on at the program. There's also an observation tool. You know, again, looking different because not all the health plans will be doing on-site assessments as was the normal intention or attention before the pandemic. So some health plans may set up a webinar like this with you where there's video access both ways, so they can you can take them around and basically give them a tour of your setting and let them see what's going on there. And then there's a community interview aspect. This isn't just going up and asking Joe Schmo on the street about your setting. That would be weird. This is more interviewing people who don't receive services at your setting, but interact a lot with your setting. So, people who come in to provide training or lead, art classes or activities, or when your staff or when your members go out into the community, maybe there's a movie theater they go to a lot, just something like that, something where the people that are interacting with your members the most, and you can provide that contact information to the health plan so they can just hear about the great things that you're doing from the community perspective. So again, we're in the middle of a pandemic. Everything's looking a little bit different right now. Some health plans may want to work with you to try and do an on-site interview because it's easier for them. So if they want to do that, they'll reach out to you ahead of time. You have to be okay with it. Obviously, it's a risk. So you have to be okay with that. And you have to have a clear list of what you want them to do to come to that setting for the on-site. So obviously wear masks, social distance, things like that. That's what you'll want to let the health plan know they have to do ahead of time. All right, and I'm going to throw it back over to Dara if the dogs have stopped barking.
Thank you. Thanks, Danielle. Yeah, the perils of working from home. My dogs aren't aware that I'm on a webinar right now. Somebody's delivering something. Again, good morning, everybody. Sorry for that disruption. So when we think about the Hcbs rules compliance, it's a lot. It's different. It's a new standard for long-term care. These are definitely things that may need to take some thought and effort, and most importantly, creativity. We want to encourage you that in some cases, there's no specific type of practice that needs to be dictated. You have a lot of flexibility. You understand what the standards are. Those are things that Danielle's gone over. But within meeting that standard, you have the flexibility to determine what are those practices. And specific to the type of setting you provide services in, specific to the members that are in your setting, maybe you have some particular kind of specialty emphasis in the setting in which you serve members. And so you can really think about and be creative with what it is you're going to do to meet compliance standards. You also have a lot of creativity and flexibility around documenting or demonstrating how you're meeting or that you will meet that standard. Particularly as Danielle mentioned, you may or may not have an on-site visit, so thinking about how you can demonstrate what you're doing to comply. And or, it could be something that's written, it could be something that is, excuse me, it could be It could be something that, you know, you have posted in your setting and it just needs to be take a picture of, those kinds of things. So you have lots of flexibility to be creative with how you document that. Danielle, talk a little bit about the transition plan, or the concepts behind the transition plan as it relates to, probably in the context specific to this, that you have, you may have closed down your program and you're looking at reopening. So the transition plan is basically, as it pertains to the Hcbs rules, how are you going to phase in or adopt these principles, or re-engage them if you had them before, the practices that meet the compliance standards, or how are you going to integrate those new practices into your setting as you start to reopen. So that's really what the transition plan is about, and you'll receive a guidance document that'll come with the assessment tool when you're reached out by the health plan for your assessment. Oh, can you go back to the reflection a little bit? Okay. So before we start to talk about and really get into the discussion today, one of the things that we've talked about internally is that when you think about members' experience with services that largely are directed by the providers, when you think about the cultural shift that we're trying to make around things being very individualized, both opportunities and restrictions, you know, COVID's taught us a lot of things. I think everybody can personally and professionally reflect on what they've learned through the COVID process and enduring a public health emergency. So I wanted just to kind of step back a little bit to see if COVID can help teach us about how what we experienced during the public health emergency and how that might inform how we understand the member experience with our programs. So first of all, so we just put these three questions together. One is, have you experienced social isolation in the past year as a result of COVID? I'm pretty sure all of us could say yes. We've all been isolated from people and from activities in our community, which are things that we didn't, want to happen, and also and because of restrictions that were imposed upon us, right? Or that we might have imposed upon ourselves. But the second question is about the restrictions. So has COVID restricted your ability to engage in meaningful activities? Sure it has, right? For all of us. Whether, again, it's been something that's been imposed upon us, or it's been something that we've done, made personal decisions to mitigate our family members from being impacted by COVID directly, or ourselves. And then lastly, because of those things, right, because we've experienced social isolation, or we are at least at risk of it, because we experienced restrictions, what did we do? We tried creative ways to connect to people and to activities. Danielle may have mentioned this, but something we've talked about is that we both love going to concerts. Well, nobody's having concerts right now, right? That's not a decision we made, but and so that restriction was imposed upon us, rightfully so. But I bought a brand new big TV so that when I stream concerts, it's enjoyable, much like if I am in a concert. So that was really something that was really important to me. So if you remove COVID from the equation and these questions, these are things our members experience. They experience social isolation. They experience having their activities restricted because somebody else determined that either it was necessary for the group or for one particular person, or maybe they just didn't get involved in the decision making that was happening. But with the HCBS rules, we have an opportunity to identify creative ways to help people connect with others and engage in meaningful activities. So we just thought this reflection was helpful to help set the tone and discussion that we're going to have today. And before we get even to the questions, I know that the folks we have on the phone today, we have a good contingency of people from the health plans. So I know some of you are providers, and just wanted to hear from you all as we engage in the discussion. Before we get to the questions, if you all could share with us, those of you who are providers, kind of where you're at. Did you close? Are you in the process of reopening? What are you thinking about now? I think that'll sort of help us with the discussion portion of today's session. So who would like to start with that? And you can just raise your hand and then we'll unmute you and give you an opportunity to share with the group. So don't be shy. This is we've been saying in the other sessions that this is certainly a judgment-free zone. So we just want to support you where you're at and help you get where you need to be. So it looks like we have a couple people, Danielle.
Yeah, looks like we have Carolyn Hutchins to start. I'm allowing you to talk right now. You'll have to unmute. As a warning, your computer may need to be unmuted and your phone.
Okay, can everybody hear me?
Yes, we can.
Okay, so I am with the Foundation for Senior Living.
Are you still there? Did you go on mute?
Oh, I'm here, I'm sorry.
Okay, go ahead.
So we have 3 locations, the Phoenix location, the Tempe location, and our Glendale location. We closed our programs on April 1st. We reopened all 3 programs on September 15th. And then we reclosed Tempe and Glendale on November 18th. So currently we're running our Phoenix location and we've combined all 3 centers into this location.
So what are your, thank you, Carolyn, by the way. Do you have plans to then reopen the other 2? So it sounds like, if I heard you correctly, you consolidated into the Phoenix location. And then are you planning on, do you have a timeline then for reopening the other locations?
We do. We're in the process right now of putting our reopening plan together for the other 2 locations. We're thinking that will be in June, prior to our new fiscal year starting July 1st. Our Glendale location will not operate in its old location. They have a brand new building that's in the process of being licensed as we speak. And they will operate on 67th Avenue and Paradise Lane.
Okay. And can I ask one more question for you? Did you have, given that you closed and you're reopening, how are you engaging with the members about their plans to come back and their intentions to come back? Is that what's informing some of your timeline for the reopening of the other 2 locations?
Absolutely. So starting April 1st, we pivoted our program to a virtual program. So we were engaging with our members even when we were closed. So right now we are in constant contact with them every week. We are making sure that they have access to our virtual programs. And we are getting their timeline as far as when they want to return and what their comfort level is. We shared our mitigation plans with them, asked for their feedback, and made changes accordingly.
Great. Okay. And I think in a minute we'll go to the question about kind of what you did during the public health emergency. So we'll want you to come back on and kind of talk a little bit about like, what does that virtual programming look like for adult day health? So we'll be interested to hear about that. Could we have, Danielle, could you unmute Christina so we can where you're at this moment?
Hi, my name, can you guys hear me?
Yes, we can.
Yeah.
Okay, awesome. My name's Christina Bolliard, and I am the Executive Director of Arizona Knowledge Empowerment and Advocacy Group. We're contracted with DDD for day services for adults with developmental disabilities. We actually added this contract as a result of COVID because of the social isolation that our members were experiencing. We added the program in August of 2020, specifically because all of the programs that our members had attended were closed down and we're not offering any in-person services. It has been amazing. All of our members are doing so well. They absolutely love the program because it's given us the opportunity to truly individualize every single service opportunity. As far as like the social isolation and kind of what we're doing to engage in meaningful activities, we actually have a mindfulness class that we run virtually on Tuesdays and Thursdays with a community member leading those classes. They're 30-minute classes, and all of the developmental home and Hcbs providers that have or homes that have requested to be a part of our day service program are able to access that. There's no additional cost or anything to them, and we made sure that they had the equipment to do so. And it has been so, they get so excited to see all of their friends and every week to tell us what they did over the weekend. And it's actually been a highlight of our week as well. And that's really kind of our most creative way to connect with all of our homes and all of our people that we work with.
Thank you, Christina. Sarah, do you want to move on to the first question?
Sure, let's go ahead and do that. So I think Carolyn and Christina alluded to this a little bit already, and others we'd also welcome you to join in. But let's talk a little bit about, obviously we know that some of you closed your settings, those of you who are adult day health providers or licensed as such, that you closed your settings, but you also did still do some virtual, and it sounds like Christina on the DDD day program side did that as well. So maybe you guys could talk a little bit more in depth as well as some others about what does that look like? What specifically does that look like on providing these kinds of services in a virtual environment, and how, and also I think too, sort of maybe what you learned from the members as a result as far as what their capabilities are in receiving services through this mechanism. So just want to open it up to anybody who would like to talk about that a little bit.
Oh, go ahead, Carolyn.
Can everybody hear me okay?
Yes, we can.
Okay. So like I had said, on April 1st, we sort of pivoted our adult day programming to include a virtual aspect. So we all had to learn quickly what a virtual adult day center looked like. So we were able to create a library of videos for our members to be able to access whenever they wanted to. And what we found, even with our DDD members, because we contract with not just DDD, but other members at other contracting agencies as well, is that the caregiver was in just as much need as the member themselves. So we added a caregiver component to that as well. We use a platform with Televata, and they give us the safety aspect of us being able to provide virtual programs with a one-click kind of system for all of our members to be able to use. So we have 11 different activities going on throughout the week. We do chair yoga, we do trivia. There's not a lot of, our calendars look very similar to that of our in-person day program. And what we're finding now as we go through the process of, getting our members back, because there are some that were, they didn't have access to the vaccine, or they were waiting until, numbers went down, or they felt safe and they were more comfortable, is that we're able to still offer them a hybrid. So if they want to attend in person to see if that works for them, great. If they want to continue virtually, that we don't have any plans to stop doing our virtual programs just because of benefits that we've found at this point. It does help us engage with our members that we aren't able to see, so that's always nice. And we also included a caregiver toolkit for some of our members to be able to use. So if they needed supplies, or if we're going to do an exercise program that they need, wrist or ankle weights for, we will able to get them to their homes and drop off those tools for them to be able to use, and then for them to be able to do creative arts and different things with their caregivers on their own.
That's great. I love the idea about the toolkit and making that available, because most people wouldn't have those kinds of supplies at their home, right, to be able to fully participate. So that's a really good supportive strategy. Did you find, Carolyn, that people had the support that they needed at home to participate?
We found throughout this process that there were people that didn't have the right internet connections, or they didn't have enough bandwidth at their homes to be able to, or they just simply didn't have the electronic device to be able to work with that. So we were able to get some of those devices donated from AT&T, and we were able to get those devices to them. So it's got a mobile hotspot for them, and it's got different things that they're able to use so that they can connect. We wanted to make sure that obviously those devices were safe. So Televita again offers us the safety aspect of our group. So, the harrowing stories of the Zoom people that jump into Zoom calls that don't belong there, that doesn't happen with our Televita platform. So.
Thank you, Carolyn.
You're welcome.
Looks like Christina would also like to share.
Hi, yeah, so we did much of the same as Carolyn was describing. When we were going through the contracting phase, we had kind of already identified what members had interest in engaging in the program with us because we were serving them in other areas. So we asked them to be involved in the creation of the program. What do you want to do? What do you not want to do? What kind of things would you like us to focus on? And then we sent the in-home providers and Hcbs providers a list of kind of some sample activities to figure out what kind of things the members really enjoyed and didn't enjoy. And then we built the curriculum around each individual member. So if they're doing a math lesson, the math lesson is differentiated depending on that member and that home and what they need. So we do have virtual components, but we also have that in-person support person, either through the hourly Hcbs or through their DTA service. And then as far as involving the member in the community, we identified things that they wanted to do. So people wanted to go to the zoo. Well, the zoo wasn't accessible, but the zoo virtually was. And then we found the zoo in San Diego was virtual. So we would kind of integrate those into a Google Classroom platform so that their providers could go in there and find those and share them with them. And then we do monthly and have done monthly since August activity boxes. So based around that kind of structured curriculum that we've created, we have activity boxes that are dropped off at the homes that are receiving services so that they have all the activities and the curriculum for the month, just the same as they would have in their classroom if they were at a center.
Great, great. Very similar kinds of approaches, but a little bit different take on each one. So thank you. Thank you. Anybody else? Oops, sorry, dropped my phone. Anybody else want to talk about a little bit about what their experience was during the public health emergency, and what activities maybe you altered or did differently or learned from during that period of time? Okay. I think we'll go to the next question, Danielle.
Alrighty. Sorry. PowerPoint is not working with me today. Here we go.
That's okay. So after now looking at the Hcbs rules, and obviously, as Danielle articulated very well, ending over the new standards, some of those things obviously can't be done during a public health emergency, but the expectation is that as things get better, as the risk is minimalized in our community, that we will have some expectations about returning back, and some of that could be to some degree. It looks like some people may want to continue virtual support or a hybrid model, if you will. But thinking about where your program was pre-COVID and thinking about the expectations under the Hcbs rules, you have an opportunity to, if you were compliant with the Hcbs rules, to re-engage those practices. And then if there were areas where you had weaknesses, then this is really an opportunity to maybe come back stronger with respect to compliance with the Hcbs rules. So I wanted to talk a little bit about your awareness of the rules and how you think that's going to impact what you do when you come back and when you kind of reopen and get to where you were pre-COVID. And this could also include any challenges you see that you might incur that would be helpful for the group to talk about.
And just a reminder to use that raise your hand function, or you can also use the Q&A box to share ideas or issues you've run into. Christina, I see your hand raised. Go ahead.
So the challenge that we're having, obviously we wrote our contract because of COVID-19, but the challenge that we're having is the services are being provided in the members' homes and are meeting all of the requirements, and the members are going to have to transition to other centers that either haven't opened, aren't going to open, are going to be relocated, are going to look different because we don't have a site. So identifying a site and identifying an ending plan, I guess, is really the biggest challenge. When is that end going to be in place? When do people have to make a definitive choice of whether or not they're going back to their old programs? And what is that going to look like? That's really tough for the adult day program side of it. For our Hcbs program, they're really our hourly services support. They're looking forward to getting back to some normalcy where they can go out into the community and have more activities. But for our adult day programs, they're really struggling with the fact that the services are going to look so different going back to their old centers.
And Christina, do you have it in thinking about, from an access perspective, our thought process would be that, I think you kind of hinted on it or alluded to it, that it's a very individualized decision, right, for somebody to make that, just like it is for me to say, oh yeah, now I'm comfortable going back to the gym, or now I'm comfortable going back to my quilting group or whatever, right? That these are very individualized decisions. Do you see that case managers, support coordinators are having these conversations during person-centered planning meetings and talking with members about their concerns or their plans? Are you involved in those conversations? Do you see that happening?
We have not seen that happening yet. However, we did this month send out notices to all of our families receiving this service and all of our members receiving this service in this way, that with some of the COVID allowances starting to be minimalized and reduced, that we want to start having those conversations. We are looking at some options for a site. That's quite a lengthy process, but because the members have expressed that they really like their current providers. They've had those providers for a long time now at home, and they really like this style of program. So really just having those candid conversations, and sometimes they're very challenging because we don't know when the end is going to be and when they're going to be comfortable going back. But no, we're not seeing support coordinators thus far engaging in that conversation, but we as an agency are.
Okay, thank you. That's very helpful.
Carolyn, go ahead.
So during we actually are seeing our support coordinators are working very closely with the social worker that we have here at the Phoenix location, trying to identify what the barrier is for them to come back to in person and what's going to make the safety aspect. And if they want to come back, how do we make that happen safely? So by sharing our mitigation plans and by going through, helping find even a COVID shot clinic and holding them here, through the vaccine clinics here at the center, we were at least able to help identify and take down some of the barriers that are associated with, families or group homes feeling safe enough to send their loved one back here, or that the member wanted to come back based on our safety aspect. I think when we closed in April, we had just started our Hcbs process. So we were able to take that summer, obviously our directors were still working. So we rewrote a lot of our policies, and we went through the Hcbs self-assessment to make sure that we were doing everything that we could do to meet Hcbs standards. And that highlighted a few things that we weren't doing, that we included, our members on, as far as, the volunteering aspect, and putting up a volunteer opportunity board in our center so that they knew where they could volunteer if that was something they wanted to do. And just making sure that we went through that self-assessment and added components to our documentation currently to make sure that we're meeting those standards.
Thank you. That's really helpful. Mm-hmm. Anybody else have anything to add? Anybody else a representative of a program that you'd like to mention, or just any ideas of challenges that you think that you might experience in trying to comply with the Hcbs rules that we can maybe brainstorm or talk through together? Again, judgment-free zone. So this is really just to try to support everybody.
Go ahead, Christina.
So I think really the consideration for if these services can be met in these 3 Hcbs rule areas would be in compliance, some direction on how we can continue alternative methods. I mean, we have been extremely fortunate that not a single member or staff have tested positive for COVID in any of our settings statewide. And we truly feel like that's the mitigation efforts and the pandemic planning that we put into place, and the compliance of that from our providers and members. So as our members are talking to their old programs, and their families are talking to their old programs that they attended, and they're hearing we had 3 outbreaks where we had to shut down our center, or some more than, that's increasing their concern in returning. Even though we've done the vaccines, they've got the vaccines, there's just so much uncertainty still. So, I mean, for example, we have an agency-owned building in a residential area, but we were told that DDD will not approve that for a day center. So we're limited in kind of how we can move forward as an agency with funding being at a loss sometimes, and real estate being so expensive currently in Arizona. It's really leaving us no options for these members other than to make the tough choice of whether or not they no longer have services when this option ends, or whether they go back to a situation they're not completely comfortable with.
So that's helpful. One of the things that is will be in the transition plan as part of the Hcbs rules assessment is what is the provider doing to communicate with members and families about risk mitigation strategies, also teaching members on how to mitigate the risk to themselves, and some of those other transparency items to help people make a decision about their level of participation, including what risks they might want to take, right? That's what we're all doing right now. It's very normative and for anybody right now to be thinking about, okay, am I comfortable now going to a restaurant, right? What are the risks? What can I do to mitigate risk for myself? And again, I think that's, partly an expectation we would have of the providers, which it sounds like the two of you are doing as far as helping people work through that, but also as part of the person-centered planning meetings as well. So that's really helpful. Thank you. Anybody else have anything to share? Well, we certainly don't want to belabor anybody's time. If we feel like we've engaged in the discussion and the folks who want to chime in have had an opportunity to do that, I definitely want to thank Carolyn and Christina for jumping in and sharing, because I think these are things that we're recording the session. We're also going to put start to put together some materials that include ideas from other providers. So many of the things you shared today we'll include in that. It's just to help providers further brainstorm. We know that not everybody could attend today's session that probably needs to. So we'll try to carry forward the discussion from today to benefit others. Danielle, maybe you could go to the next slide. Thank you. So there's lots of already recorded sessions on the website. Those of you, if you need just an overview of the Hcbs rules more in depth than what we were able to go through today, there's actually one on the provider self-assessment tool. We are working on an update to our website to include that suite of tools that Danielle went over earlier, which then also contemplates sort of the public health emergency and the transition plan as it relates to COVID, which at the time we did the provider self-assessment tool training, that wasn't a reality for us. So it's a little bit different. So there's a number of sessions there. You definitely want to sign up for the constant contact email list if you haven't already. We're going to be doing a lot of communication between now and for the foreseeable future about the Hcbs rules, including starting to put together some member communications that you all may be able to use as you're engaging with members. Certainly, Danielle and I are also available to provide any kind of technical assistance or support that we can provide. There's our email address, the hcbs@azaccess.gov, that goes to both Danielle and myself. So if you have questions as you're trying to work through this process, or you need some technical assistance or can't find something that you think would be helpful, definitely reach out to us. Danielle watches that email all day long, so we're extremely responsive to that. So feel free to stay in touch with us. Also just want to offer a thank you, not only for your participation today, but also just for the work that you're doing to serve our members. We always want to take an opportunity to acknowledge that our members are supported and largely by the work that you all do. And so we appreciate it. It's certainly not an easy job to begin with, just because of all the complexities and the uniquenesses and nuances of all of the members and their specific needs, but also even more difficult during a public health emergency. So thank you for doing what you're doing to keep members engaged, to be creative, both your efforts today and in the future. So again, thank you for your participation today, and look forward to sharing more information with you in the future. Have a good day, everybody.